Now continue by looking at the specifiers of our unipolar depression or our depression disorders. Now, why is it important to include the specifiers and to know the specifics of the particular disorder? It's because it will help guide the interventions that we need to give to our client. And as you will notice, there are a range of specifiers that we need to check, because just because a person is saying he or she is depressed and is exhibiting the basic symptoms does not mean it's all the same, especially since you all know from the previous video that two people with depression can present very differently, and so it's important to spot some of the important criteria or some of the important symptoms we need to consider. So the first one, and perhaps one of the most common, would be anxious distress. So a major depressive disorder with anxious distress. Okay, and what that means is that there's a co-occurring anxiety disorder. So comorbid siya. You have major depression, and then you have an anxiety disorder, or maybe there are symptoms of an anxiety disorder, but they do not qualify for a full diagnosis of any of the anxiety disorders from the previous chapter. Usually, this is the kind of mood disorder where there are suicidal thoughts, and there is often sometimes completion here, and a poorer prognosis. So meaning it's difficult to treat this if you have comorbidity than if you only had, let's say, major depression with some of the other features, or anxiety disorder alone. Okay, so you have to address both the anxiety and also the depression. So next would be mixed features. So here there is mainly depressive episodes, but there are at least 3 symptoms of mania. But take note, it does not qualify for a full manic episode. So hindi rin siya pwedeng ma-lump into the bipolar category. Okay, so it's applicable both for major depressive disorder or persistent depressive disorder. Next is next is melancholic features. So for here, there is a full criteria of the major depressive episodes. So halos lahat, diba? You have the nine symptoms that you need to watch out for. So almost all of those things, as opposed to just 5. Okay, and it includes very severe somatic symptoms. So, typical na pagod, parating nakakasakit, and then there's really a lot of weight loss. So, if you think about like overeating or undereating, this type is more of the undereating, not sleeping. So there's weight loss, there's loss of the sex drive, and then when you say hopelessness and guilt, it's really more severe compared to just other forms of major depression. So with if you have melancholic features, it's like really the stereotypical na down na depression. And then you have another one, the seasonal pattern, which is actually more common in countries that have like winter and autumn, but may also be possible in other places. So for the seasonal pattern, your episodes coincide with the seasons of the year. So for example, because it's dark and just snowy and just cold pag Christmas season or winter season, and then you feel like your mood is also the same. So you're very down and it's just very cold and you feel very empty during those times. And the treatment will also be suited to you to deal with that. So for example, pag summer or spring, you don't experience the depressive episodes, because you're also like, okay, your mood is okay, you're getting a lot of sunshine. The next would be peripartum onset. So it used to be postpartum, so meaning after birth na experience of depression. So you're probably very familiar with that. But when we say peripartum onset, it's surrounding surrounding the pregnancy. Okay, so it's during the pregnancy. Okay, and then 6 months after the birth. So it's more specifically surrounding the birth of your child. So throughout your pregnancy, you've had times when you were down, so medyo parang you'd say parang lutang, 'di ba? And then it's either you don't eat, or you eat a lot, you sleep, or you don't sleep a lot, and then you have inability to concentrate. Okay, so that's it. And then after, sometimes you neglect your child instead of taking care of your child, or you may be blaming yourself for not being a good mother to your child, so there's a lot of guilt involved. So that's peripartum onset. And then another one would be catatonic features. With catatonic features, so there's the absence of movement, or the stuporous state, or cataplexy, where your muscles are waxy and semi-rigid. Okay, so they remain in a particular position. So this is also a more severe kind. So this is often one where you stay in your room a lot of time, you're not moving, so there's psychomotor retardation here. The next one is when you have atypical features. So this is the where you often see the person oversleeping and overeating, but you still have the ability to react with interest, and you still have pleasure to do things. But okay, so wala siya masyado ng issue ng anhedonia, but merong yung depressed mood pa rin. And it's associated with more symptoms of more suicide attempts, and a higher comorbidity with another disorder, and it's really more common in females and usually shows up earlier. And then the last one, and one of the most severe also, when we talk and one of the ones that we also need to be addressing with multiple interventions, would be those with psychotic features. Okay, so this is more for the bipolar, but pwede rin for depression. You're not gonna expect to see this in persistent depressive disorder, because it's just a mild form of disorder. Yung major depression with psychotic features, you see that pag severe siya. Okay? So it can be mood congruent or mood incongruent. So pag mood congruent siya, something like when you have a depressive episode, feeling mo parang yung body mo nag-disintegrate or naaagnas, or just slowly just going away, diba? So you have somatic delusions. Okay, and then let's say you hear voices telling you very negative things about you, so that's mood congruent. And then the mood incongruent naman is, for example, when you believe you are something, you have delusions of grandeur or grandiosity when you have a depressive episode, because generally pag merong delusions of grandeur, that's commonly associated with a manic episode, diba? Very, very hyper, very expansive na mood. Okay? So, very often, yung mood incongruent na psychotic feature, it may co-occur with schizophrenia. So, you also have to consider the possibility. So, meaning, comorbid siya with schizophrenia. That's why merong ganyan. Or it's also something that you have to treat first. So you have to also check into treating that initially.